नमस्कार मंडळी. तुमच्या सगळ्यांचं आरोग्य संपदाच्या सेशनमध्ये स्वागत. हे आपलं 5वं सेशन आहे आणि तुम्ही आतापर्यंत जो प्रतिसाद दिलात त्याच्याबद्दल धन्यवाद. आज आपला विषय खूप स्पेशल आहे, वुमन्स हार्मोनल जर्नी. आणि उद्या आंतरराष्ट्रीय महिला दिन आहे, इंटरनॅशनल वुमन्स डे. टू सेलिब्रेट दॅट वी डिसाइडेड दिस इज अ व्हेरी इम्पॉर्टंट आणि महत्वाचा टॉपिक आहे. तर तुमच्या सगळ्यांचं या सदरात स्वागत. आज आपल्याबरोबर आहेत डॉक्टर कोमल पाटील सिसोदिया आणि त्या 16 वर्ष इंटरनल इन पेशंट आउट पेशंट केअर एक्सपिरियन्स आहे त्यांना. शी इज ऑल्सो ट्रिपल बोर्ड सर्टिफाईड डॉक्टर, इंटरनल मेडिसिन, एंडोक्रोनॉलॉजी, ओबिसिटी मेडिसिन आणि मेनोपॉज केअर. दीज आर हर स्पेशालिटीज. आणि बाय द वे त्या सेकंड जनरेशन आहेत. सो that's the best thing, that we are having next generation doctors also joining our session. So Dr. Komal Sisodia, congratulations and welcome to our session.
Thank
She
you
is
so
also a
much.
public speaker. Yeah, she's a public speaker and currently working as an executive medical director in Seattle. स्पेशल थँक्स टू डॉक्टर आरती तायडे. त्या पण सियाटलच्या आहेत आणि त्यांनी मला डॉक्टर कोमल यांची ओळख करून दिली. Both Dr. Taide and Dr. Sisodia will be leads in BMM Convention's CME session in Seattle. So if you're joining, you will be seeing them there as well. आणि लास्ट बट नॉट लिस्ट, थँक्स गौरव. गौरव आपल्याला नेहमीच मदत करत असतो हे सगळं सेशन, मार्केटिंग, आणि थँक्यू सो मच. तर विथ दॅट सेड, अगेन वेलकम टू दिस सेशन. उद्या आंतरराष्ट्रीय महिला दिन आहे, तर आपल्या सगळ्या भगिनींना आंतरराष्ट्रीय महिला दिनाच्या शुभेच्छा. आणि लेट्स गेट स्टार्टेड.
Okay.
थँक्यू डॉक्टर कोमल. प्लीज गो
Thank
अहेड.
you so much. Namaskar सगळ्यांना. And माझं मराठी जरा मोडकं तोडकं आहे, so I will be giving my talk primarily in English. And any questions I'll do my best to answer. So thank you so much for having me today. And I'll go ahead and share my presentation so we can get started. And my understanding is that we are going to have everybody please put their questions in the chat, because I that's the best way to do it. And one of the things that I've been asked to let everybody know is that with the talk, please make sure that the questions are not personal questions. I can answer general questions. Anything personal I can't address outside of a medical visit. So just so we know, this talk is purely for educational purposes. So thank you again so much for having me today. Today I'm going to talk about a topic that is very near and dear to my heart, women's hormonal journey. And a lot of research has not been done in women's health as much has been done in men's health. And so, one of my goals with the care that I provide is to make sure women at all ages are understanding what's happening in their bodies and why it matters to them. Let's see here. Okay, here we go. So my disclosures, anytime we give a talk, we have to give our disclosures. I have, outside of my regular jobs, I have a small menopause practice in Redmond, Washington called Eastside Menopause and Metabolism. I have a women's health podcast called Reset Recharge, and then I consult for a company that is focused on women's health called the Fit Collective. Let's see here. So our objectives for today's talk are I'm going to go walk us through the 4 hormonal stages of women's health. We're going to talk about common health issues in each stage and learn when symptoms will deserve medical attention. And my goal is to have you all understand how to advocate for your health at the end of this talk, no matter what stage of life you're in. This is my why. This is my beautiful mom, Jayashree Patil, and my sisters Preeti and Neha. And for all the women in my life, this is why I do the work that I do. I've seen firsthand with what's happened in my family, as well as all of my patients, how much women's health can have an impact if we're not getting care at the right time. So this is dedicated to my mom, my sisters, my nieces. And all the women out there who are not able to get care for themselves in a timely manner. The roadmap that I like to put out for women is that change is really the only thing that we have that's constant in our lives. We go through so many different hormonal shifts in our lifetime. We have childhood, we have puberty and adolescence where our hormones are first starting to increase. We have reproductive years where we're looking at fertility and pregnancy. And then after that, fertility starts to decline into perimenopause. And then when we stop menstruating, we have postmenopause. And each of these eras of our lives have a different health impact. And so today I'm going to walk through each of those so you understand when those stages occur, what are the problems associated with each of those stages, what's normal, and then when to reach out to your doctors for help. So, that's what we'll focus on for most of today's talk. I want to start with talking about what are hormones, right? Hormones is a big question. It's really my entire specialty with endocrinology. Hormones are what I like to call the body's messengers. So they will send signals to different organs in our body. Our body will react in different ways, and they will influence things like growth, reproduction, mood, or how our body metabolizes the food that we eat and the calories that we process, how our sleep is, and then lastly, how our brain functions. So, hormones will affect everywhere in your body from head to toe, and it's important to understand that. But there are also lots of different hormones in the body. And so, for the purposes of today's talk, what I will be doing is focusing on our reproductive hormones because those are the ones that fluctuate mostly throughout our lifetime. And there are three key reproductive hormones in women, and those are estrogen, progesterone, and testosterone. Hormone levels across a woman's lifespan, specifically reproductive hormones, we see change quite significantly. So in childhood, they're at their lowest throughout childhood, and then moving into adolescence when girls hit like their preteen, teen era, that's where menstrual periods start and the hormones really start to rise. And we see that cycling of the menstrual cycles. And then as we hit our peak reproductive years, that is where pregnancy becomes really the big hot topic of conversation, pregnancy and fertility. And then as we hit midlife into our 40s and beyond, we see the decline in the hormones. And that is really kind of that reproductive arc of hormones that we see across a woman's lifetime. The one thing to know is that hormones are dynamic. They are constantly changing, which is why our bodies are constantly changing. And hormones will shift with age. They can be affected by stress. I have so many of my patients come and tell me that, I had a very stressful time at work and I skipped a period. Is that normal? Sleep disturbances can also lead to that. Your hormones will be very different than when you're not pregnant. And then when you're sick, your body does not want you to reproduce consistently while you're sick. So sometimes what will happen is the hormone levels will decline during illness as well. And with each stage of life, that looks a little bit different. And so you'll have different health priorities or things that you need to focus on for your health, depending on what stage of life you're in. So, starting with stage one, we have puberty and adolescence. And this is ages 8 to 18. And this is where girls will really start to see changes in their bodies. They may start their menstrual period, they may start developing acne, they will have breast tissue development, and they will start developing body hair. All of these things can be very distressing to young women. And I've heard countless stories of women from our Indian community who depending on the generation, were not necessarily told about all of the changes in their body. And I think it's very important to start educating our girls while they're still going through these changes about what is happening to their bodies, what is normal. Luckily, nowadays in the school setting, they do a lot around reproductive health and getting girls and boys to understand what changes are happening with their bodies. But this era of puberty and adolescence is generally the start of when the reproductive hormones kick in. Again, we see the breast development, we see menstruation, and the other thing we see is rapid bone growth. So, this is where girls will start to get taller and start achieving close to their adult height. And this is, again, we have to normalize this for young girls because a lot of times culturally, they're taught to not ask questions or just bear things and not really fully understand what's happening with their bodies. And it can be a very scary time for girls as they're growing up. Now, teen health challenges, we have to empower our girls. Again, I'm going to say this word a lot. We have to empower our girls with knowledge of their bodies so that they know when to ask for help. And really, the biggest challenges that I see in teen girls are going to be painful periods, right? When the periods first start, they can be painful. There can be severe cramps. There can be a lot of just physical pain that they go through, and it can be a scary time. And sometimes girls are scared to ask for help during that time. When we have simple fixes like heat packs or Tylenol or Motrin that can help them. The other thing that happens is the cycles are very unpredictable because once they start up, our body is trying to learn what the natural rhythm will be. And so the cycles can be irregular and it can be very hard to predict. So making sure our girls are supplied with all of the appropriate reproductive health things like pads, tampons, so that they're not caught in a situation where it can be embarrassing for them if they don't have the right supplies to help with their menstrual cycles. Acne can be another thing that is very, very distressing. As the hormone levels are rising and shifting, that can cause changes in the skin. And a lot of teen girls struggle with acne. Sometimes it can be hormonal, sometimes it can be hygiene related, and really getting them to a dermatologist or their pediatrician who understands these changes for help with that can be life changing. This is something that I remember struggling with when I was a teenager, and it can be very hard when you don't have the right tools to get your skin under control. From the heavy periods, when girls are having very heavy bleeding, their iron levels can drop, and that can cause fatigue and not being able to concentrate in school and all sorts of other things. So it's important for girls to be talking to their parents about these changes so that they can advocate for help. Sometimes just simple iron replacement or going and talking to the doctor about potential medical treatments to help regulate those cycles can prevent that iron deficiency. And the other thing that happens is mood changes start to happen, right? As the hormones are fluctuating up and down, that can really affect mood. And I know that, growing up in a household of three sisters, there were a lot of mood changes, and my mom was patient with us, so that was really helpful at that time. But when you have those mood fluctuations, it can really affect the dynamic in the household, right? And sometimes the parents will look at the teen girls and say, oh my gosh, they're misbehaving, they're doing this, they're doing that. But a lot of it is physiologic, what's happening in their bodies. And a lot of times they don't have control over those mood changes. So creating an environment where it is safe for our girls to talk about this openly, like, I don't know why my mood is changing like that, and figuring out whether it's time to their menstrual cycles and helping them understand that this may be a natural fluctuation and a natural cycle. And obviously, there are healthy ways to express emotions and changes that are happening during that time, but that conversation is very, very important. And then lastly, there are body image concerns. Everybody's bodies grow and change at a different rate. There may be weight gain before there's growth in height. And so that shift around what girls think they should look like instead of just letting their bodies grow normally becomes a area that we all kind of fixate on, and it can cause some mental distress, anxiety, depression, if we're not helping them move through these changes in a healthy way, right? So a lot of times just sitting down and addressing with the girls that these changes are normal. Just because you have gained a little bit of weight doesn't mean it's going to stay like that forever. You may grow taller and it may all balance out, but framing it in a way that it's normal for your body to change, not that there's something wrong with you, right? So that our girls know that these changes are normal. But we can also offer help by having them talk to their pediatricians or other doctors, and also providing a supportive environment at home. Now, when do periods need medical attention? A lot of times girls just kind of grit their teeth and try and get through it, and they're embarrassed to talk about these things. So I always recommend these are the red flag things that I think we should take our girls in to see their doctors for if they're having extremely painful periods, if they're having very heavy periods where they are having to use multiple pads and tampons throughout the day, If they haven't had a period for months, that can be a problem, and that can be signal some sort of hormonal changes that need to be addressed. And then if the periods are so bad that they're causing missed school or missed work, that's when they need medical attention. When you're not able to function on a daily basis through your life, that is really when you need to go see a doctor to get attention for the periods. See here. So now we'll move a little bit into stage two, which I call the reproductive years. And this starts in the early 20s through the early 40s, right? And for every woman, this looks different. Some women have a much longer reproductive span compared to others. Some women may go through may not be able to get pregnant in their early 40s, and other women are able to get pregnant well into their 40s. But the major thing that we see is we see menstrual cycles happening usually in a consistent period, unless there's something hormonally that's not going on well. And usually most women, and this is not all women, have around a 28-day menstrual cycle. Anywhere from 24 to like 34 days is considered a normal cycle, but for textbook purposes, we always frame it within that 28-day cycle. That doesn't mean that if you have a 30-day period or a 25-day period that something is wrong or abnormal. That's just normal fluctuation and differences between people. But generally, the hormones will follow a monthly cycle. And based on the 28-day scale, we see an increase in the first phase is called the follicular phase, which is the first 14 or first half of the period. And here we see this is really the first day of the menstrual period where we start to shed that uterine lining. And once that shedding is done and the bleeding is done, the estrogen levels are increasing during that time to build the lining back up. And the purpose of building the lining back up in the uterus is to prepare it for a potential pregnancy. Because around the middle point of the cycle, all of the hormones, the FSH and the LH, rise in order for the ovaries to ovulate and release an egg. And if that egg is fertilized, then it will attach to the surface of the uterus, and you will move on to a healthy, or hopefully a healthy pregnancy with that conception. But for the cycles where we don't have a fertilized egg attaching, which is like the overwhelming majority in our lifetime, that then the period shifts into what's called the luteal phase, where the progesterone starts rising, and then the uterine lining starts being prepared to get shed towards the beginning of the next follicular phase. And so it will go through these 28-day cycles or 30-day cycles or whatever it is, and this happens monthly for women, right? And you look at this picture and you think, my goodness, there's so many hormones that are changing just in that 28 days for us to have one period. And I often jokingly say we go through more, not kind of not jokingly, we go through more hormonal shifts in 1 month to have a period than a lot of our male counterparts do, right? And so sometimes it can be hard for husbands, brothers, parents to understand what exactly children what is happening with their female relatives because they don't have a basis for comparison. So one of the major things I always say is we have to be sensitive to these hormonal changes and know that things are changing. Doesn't mean we can't live life productive or happy or able to do everything we want to do, but these are changes we have to be aware of, right? And during these reproductive years, really what women are focused on at that point is, fertility and seeing if they can achieve pregnancy, if that's something that is a goal for them. They are worried about contraception because if they don't want to have children, then making sure that they don't get pregnant during this cycle is also something that they're balancing. And then you look at the stress of work, family, and just daily life stress. This is a very busy time for most women, from 20s to early 40s, where you are really trying to balance so many different things, all while having these monthly hormonal fluctuations. So the monthly hormonal shifts will affect daily life by affecting things like concentration, mood, sleep, appetite, energy, and all of these things really impact how we function on a daily basis, right? How are you able to get through the stress of your day? How are you able to show up at your job or for your family as a wife, as a mother, as a sibling? And it can be very it can be challenging if those hormonal shifts are difficult to manage. So, common health issues that we see in the reproductive years that I always recommend people talk to their doctors about are PMS, which stands for premenstrual syndrome, or PMDD, which is premenstrual depressive disorder. These are the major mood changes that can really affect the environment in the home or in the workplace. If moods are difficult to control during that time, there is medical treatment for that. And so women can get some relief of those symptoms by talking to their doctors. Another big one that comes up is endometriosis. Endometriosis is where the lining of the uterus has built up and sometimes is moving in areas in the pelvis outside of the uterus. And this can cause very significant bleeding and pelvic pain. Sometimes you may not even have heavy bleeding, but you'll have a great degree of pelvic pain during the periods. And so this is something that I think is very important and is very underdiagnosed in women, actually. A lot of women have this, and I think we have learned not to complain, so we don't advocate for ourselves and ask for help appropriately with that. But there are medical treatments for that. There's another condition called polycystic ovarian syndrome, and I see this in my clinic. And a lot of times, what we see here is that there are irregular menstrual cycles. It can affect fertility and ability to get pregnant. The other thing we see with this disorder is that it can increase the amount of testosterone circulating in women, and that can cause issues like acne or facial hair growth that is very thick, scalp hair loss, increased body hair. And this can be very distressing to women, right? Because a lot of our identity is tied to our scalp hair and how we look and things like that. And sometimes this can cause pretty significant changes. Fertility challenges can be another thing, right? One of the common trends we're seeing in women across the world is that we are having children later. And for some women, that can become problematic because their fertility may have peaked earlier compared to somebody else that they know. And so, talking to a doctor, if you are trying to get pregnant and you have not been able to get pregnant within 6 months of trying, you can get a fertility evaluation to help you get pregnant. Thyroid disorders also increase in women over time. And the thyroid disorders, I think it's estimated that 23% of women will have some sort of thyroid dysfunction by the time they're postmenopausal. And in our Indian population, our Desi population, we actually see quite a bit more autoimmune thyroid disease. I think it's estimated up to 12 to 16% will have autoimmune thyroid disease. And then we also see a lot of postpartum depression and anxiety, right? There's so much stress that we're managing in terms of trying to balance home life, work life, personal health. After having a baby, there can be very big hormonal shifts, and women can be prone to postpartum depression and anxiety. And there's treatment for that as well. And this one in particular is very important to talk to the doctors about if you're seeing those changes or trends in yourself, because it can affect how you're bonding with your baby and how you are taking care of yourself. So these are common health issues that I see during the reproductive years that I think you absolutely, absolutely have to reach out to your doctor and talk to them about. Let's see here. So, next is mental health and women's health in general, right? Women will experience higher rates of anxiety, depression, and autoimmune disease, which can also impact mental health. It's estimated that of all of the autoimmune illnesses, and when I say autoimmune illnesses, this is where your immune system, which is normally supposed to protect you from things like bacteria and viruses and illness, malfunctions and starts impacting or recognizing parts of your body as the enemy, right? So we'll see things like autoimmune thyroid disease that you may have heard the terms Hashimoto's or Graves' disease. We have things like rheumatoid arthritis or psoriatic arthritis or lupus. These are all autoimmune conditions that can affect women's health, but then also have an impact on mental health as well. And hormones and life stress, when they come together and they're not functioning well, can both contribute to all of these types of conditions. So I think that that's important to remember. Now let's talk a little bit about stage three, which I call perimenopause, which is called perimenopause. And this is generally women 40 plus. But women of Southeast Asian descent and Indian descent tend to go through perimenopause a little bit earlier. So in our population, we can see these symptoms start as early as 35 and late 30s. And what we see is that our periods that are normally happening every 28 days, they start to become very irregular over that 5 years leading up to menopause, really 7 to 10 years for some people. For some people, it's much shorter and it can be 1 to 2 years. But what you'll see is that instead of happening at very regular intervals, they're kind of spacing further apart or closer together. The other thing that happens is that the hormones start getting out of sync. And the reason for that is that the ovaries are starting to run out of eggs. In women, when we are first conceived, we have a set number of eggs in our ovaries that are supposed to last us our entire lifetime. And at conception and when we're developing, uh, when we're still inside our mother's uteruses, right? What happens is that I think we're born with or we're conceived with around 12 million eggs. And over time they start dropping. And by the time we hit birth, we're down to 1 million eggs. By the time we hit puberty, we're down to 500,000 eggs. And by the time we hit our reproductive years, we're down to anywhere between like 200 to 400,000 eggs, depending on the person. And so you see the steady decline of that. And that's really why you see the hormone levels start to fluctuate because the ovaries are running out of eggs. And that is really where menopause happens because you have no more eggs left to ovulate. And that is when the last menstrual period happens. And I'm speaking in generalities. There are some women who get pregnant around the time of menopause or shortly thereafter because they still have a few that are left. But really, what you see is this what we call hormonal chaos, where the hormones are going up, down, up, down, up, down until the periods stop. And when you look at this diagram, you see that, really it's a year after the last period where the hormone levels really even out and you can actually consistently check them on lab tests. A lot of women will come into my office feeling not well and say, "Oh my goodness, can you just check my hormones?" And I show them this diagram and I explain to them that during this time up to menopause, things are so unpredictable that it's very hard to get a good snapshot of what your hormones are. And so, really, what I advocate for is that women look at their symptoms. And the most common symptom of perimenopause, and this was presented at the Menopause Society conference last fall, the number one symptom is I just don't feel like myself. It's very hard to pinpoint one symptom, but the overwhelming statement from perimenopausal women when they were studied at the study that was presented at the Menopause Society was I just don't feel like myself. And the unfortunate part of this is that when you go into a doctor's office and you can't articulate or you can't verbalize a very clear complaint like my head hurts or my stomach hurts or my elbow hurts, I just don't feel like myself makes it very hard for doctors to think, my goodness, I don't know where to even work you up for, right? And so the other thing that I think it's very important to counsel women on is that we have estrogen and progesterone and testosterone receptors everywhere in our body from head to toe. And so the symptoms of perimenopause and menopause are extremely varied. There are like 80 plus symptoms. We talk about a few of them, but the most common symptoms that I see in midlife and women who are coming into my office asking for help are going to be things like hot flashes, night sweats, heat or cold intolerance, where it's very hard for you to adjust from hot temperature to cold temperature, or you feel cold really easily or hot really easily, feeling tired, having sleep disturbances. There can be an increase in headaches. Really, for a lot of my women who are in midlife, brain fog and decreased concentration and memory changes can be a big deal. I'll give a funny story. I was talking to my husband probably about a month ago, and we talked about two things that we were wanting to have for dinner. We decided on one, and I walked from upstairs to downstairs stood in my pantry, looked around, and I could not remember what we talked about. So I just randomly started making something else. And he came downstairs and said, "What are you doing?" I said, "I couldn't remember, and I was too embarrassed to go upstairs and ask you." But this can be a really real thing, right? And it can affect your daily life in small ways like that. There can be mood changes, irritability, anxiety, depression that starts changing as your hormone levels are changing. Um, we can see skin changes where skin gets dry or more irritated. We see more hair loss. We see nails get more brittle. It can affect our heart where we feel more rapid heart rate, and that can be associated with anxiety as well. One of the major symptoms that we start to see is also a loss of muscle mass and increased joint pain and difficulty with just movement, feeling stiff and not really motivated to get up and go work out. This can lead to issues with balance, and we worry about that because bone health becomes important later in life. The other thing that happens as our estrogen and progesterone decline is that our body composition starts changing. So it becomes very difficult for us to hold on to muscle, and our body is actually able to create fat tissue more easily. And the reason for that is that our fat tissue produces estrogen. So it's almost like the body's way of trying to save itself. But that causes other issues like increase in blood sugar, increase in blood pressure, increase in cholesterol. A lot of women will also see what we call genitourinary syndrome of menopause, where they are noticing a decrease in their libido. They are having vaginal dryness or pain with intercourse, increased frequency of UTIs. And this is because the muscles in the pelvic floor, as the hormone levels decline, get weaker and start to collapse. And in the example of the urinary tract infections, what happens is that as that pelvic floor collapses, our connection between the bladder and our external skin and genitalia shortens. And so the bacteria has a shorter distance to travel into the bladder. And a lot of women will see an increased risk of urinary tract infections or actually increased urinary tract infections. And these are all symptoms of perimenopause and menopause. So it's very important for women to really start paying attention to their bodies in midlife. Unfortunately, this is the time where we are the busiest, right? This is where we are getting our kids off to school, where we're trying to make strides in our career, where, there are so many different life stresses that are happening. A lot of times we just don't pay attention to ourselves because, I think worldwide culturally, women are taught to put everybody's needs before their own. And sometimes we just don't have time to pay attention to ourselves. So I always tell my patients that come in is that if you're not taking care of yourself, it's going to make it much harder for you to take care of everybody else in the way that you want to. So really everything starts with self. You have to take care of yourself and pay attention to your body. Um, Again, this is, why so many women are unaware of this stage, right? The symptoms, we often will blame them on things like stress or, oh, this is just a normal part of aging, or I'm burned out at work and with all of the kids' activities, life is just too busy. But it's really the hormones that are driving this change. And I have this on two slides because I think it's that important for us to know. Let's see here. So, what happens with the natural history of aging in midlife women, right? So, as our hormone levels decline, if you look at the natural history of aging in women, the hormones start unmasking all these chronic health conditions, right? And women will, as their hormone levels decline, start developing things like heart disease, osteoporosis or weakening of the bones, the metabolic syndrome like prediabetes, diabetes, high blood pressure, high cholesterol. They'll develop musculoskeletal disorders, cognitive decline and dementia, sleep disorders, depression, and then cancer risk also starts to increase around that age. Breast cancer, endometrial cancer, ovarian cancer. And this is without any sort of intervention or looking at long-term health, right? And cancer can happen in anybody at any age, but it really does increase in incidence following menopause. And the point that I want to drive home with this is that it's not just one event. This is going to be like the last third of your life. And so it's more of a spectrum versus an actual event. And we will find that we'll go from late reproductive stage where the cycles slowly start to change. There are certain labs like the FSH that will start to rise into perimenopause where the cycles become irregular. You could develop things called vasomotor symptoms like hot flashes. You'll have mood changes, sleep issues, brain fog. Menopause happens around the average age of 51, and that it's defined really as 12 months without any menstrual periods or amenorrhea. And then postmenopause, this is where that genitourinary syndrome of menopause, the bone loss, the cardiovascular risk, um, the attention concentration, memory changes really start to occur. And a lot of women will come to me with this vague complaint of I just don't feel like myself. And so there are online tools that are available to all of you. And the two that I really like to use are the green climacteric scale and the menopause rating scale. So if you're in that perimenopause midlife period and you're having a hard time telling your doctor that this is what's going on with me, you can go online and search for one of these scales. And the green climacteric scale is the one that I like the best and the one that I use in my practice. But it's 21 questions that go through 21 symptoms of menopause. And you rate them as I don't have any, they're mild, they're moderate, or they're severe. And because it's 21 questions and a max of 3 points per question, the max score is 63. A score of 12 or higher is considered positive, and you can use that if you do that online assessment and then take that to your doctor and say, you know what, I'm scoring positive on this scale that says I'm having significant symptoms of menopause. You can do the same thing with the menopause rating scale. This is a shorter questionnaire that's 11 questions, similar rating scale, except they do 0 to 4 points, and a score of 14 or higher is important. So, whatever you can find online to do the self assessment is very, very helpful. And what I can do is I will send some links that I like out to the team so that they can maybe distribute that or put that on the website if that is something that people want. And then the last stage that we look at is postmenopause. And this is, sorry, the average age is 51 and beyond. And a third of our life is spent in that postmenopausal period, which is that right side of this graph where the hormone levels have really declined significantly for the estrogen, progesterone, and testosterone. And the postmenopausal health considerations, like we've gone through, are going to be cardiovascular disease. Heart disease is the number one killer of women worldwide, and that increases significantly after menopause. Osteoporosis, cancer screenings, sleep apnea. It's estimated that 80% of women who have sleep apnea don't know they have it. And a lot of the reason that it can happen is either because they've gained weight during menopause or the musculature in their neck has gotten weaker, even if they haven't gained weight, and their airway closes off. We see that increased rate of thyroid disease. Autoimmune illness goes up. The genitourinary health conditions start increasing. We see muscle loss and balance issues. And then we see metabolic disease like diabetes risk, high cholesterol, high blood pressure, all of that starts increasing. And so, really, at annual visits with your doctor, you should be talking about all of these things. What I find is a big correlation is that depending on what your family history looked like, meaning what your parents had, right? If your parents had diabetes, heart disease, high blood pressure, cholesterol issues, the odds are that postmenopausally, this is going to start to become an issue for you. So, not only do we have to look at all of these conditions, it's really important to know your family history. And it's hard because sometimes culturally, the older generations haven't wanted to talk about this because there's been sort of a taboo around this topic. But the more we can do to tell our future generations about what health conditions run in the family, the better they can protect their health, right? And the better you can get help for yourself, no matter what stage of life you're in. I wanted to take a minute and talk about a study that has really, in my opinion, adversely impacted women's health, and that was the Women's Health Initiative, which was a study that was done in to look at hormone replacement to determine whether it was going to provide some cardiovascular protection. That was the goal of the study. There were also two other pieces that we don't talk about it that looked at vitamin D and calcium supplementation. Just overall health. And so, really, when this study first came out, the way that it was documented in the headlines, because they evaluated the data looking at all the women they'd recruited. So it was all the women aged 50 to 79 and the average age of 63. And they had put these women in two groups where they put one group on estrogen and progesterone if they had not had a hysterectomy and still had their uterus, or just estrogen by itself. And because they looked at everybody together, the initial data was not accurate, but everybody ran with the headlines. And this was in 2002. So, sometime while I was in medical school, all of a sudden, hormone replacement therapy was bad, and the media ran with it, right? So, what we saw was, HRT trials stopped due to increased risk of breast cancer, stroke, and heart attack. Hormone replacement study, a shock to the medical system, and the impact on women's health was really bad. The hormone replacement therapy prescriptions fell by about 30% almost immediately, and we stopped prescribing hormones to women because of this. The interesting thing is, a few years later, they actually said, oh, wait, we might have been wrong. We should really look at these women in age brackets, meaning 50 to 59, 60 to 69, 70 to 79. And the women in the 50 to 59 age group in both categories actually had benefit from hormones. But the damage was already done. Finally, in May of 2024, the Journal of the American Medical Association went back and reanalyzed the data. And the original study authors said, wait, we were wrong. And it's the same exact study, but look at the difference in the headlines from 2002 to 2024. Now we're saying HRT for menopause is safe for some women. And the funny thing is today called it a new study. It wasn't a new study. It was the one that was done in the early 2000s. The next headline is menopause therapy fears were overblown, the Women's Health Initiative finds. And, this is really sad and scary because we let one study dictate how medical care would be for women for 20 years. And we are already behind because most women's health research didn't start until 1993. So we need to do better with that. And this is why I'm really trying to encourage women to step forward and advocate for themselves because you can have a better quality of life. Let's see here. Um, I always talk about pillars of menopause management, right? There are some women who have unfortunately had breast cancer, ovarian cancer, uterine cancer, and hormone therapy is not always available to them in a systemic form. And so, a lot of times, especially with this new resurgence in menopause interest, a lot of them feel left out of care and they think, my gosh, if I can't have hormones, there's literally nothing else I can do to improve my health. And that's not true, actually. There are so many pillars to good health, and we can't pin all of our hopes on one thing, right? So we have to look at all of the different things that we can do to impact our lives, because if you're doing the majority of these, you're improving your health, right? So focusing on your nutrition, are you eating a good amount of fiber? Are you getting in heart healthy protein? Are you hydrating enough? Secondly, are you moving your body? Are you being physically active? Are you trying to do some strength training to hold on to your muscle mass? Are you making sure that you're sleeping well? This is harder and harder now that we have more devices that distract us. I'm not great at putting my phone away before I go to bed, but on the nights that I leave it in a different room and I haven't looked at a screen for like an hour before I go to bed, I sleep better. Doing some sort of mindfulness or meditation techniques to reduce your stress can also help your health. If you do start developing diabetes, high cholesterol, high blood pressure, and it's not responding to all of the lifestyle things we just talked about, accepting help in the form of medication, right? You needing medication is not a failure of you. It is happening because your body is changing and your genetics that you inherited from your family these diseases run in your genetics. So it is not a personal failure. And for any patients, men or women, I tell them, Accepting medical help is not a failure on your part. It is something that you need to do. That's why we have medicine. That's why we have science. We have all of these things so that we can extend human life and improve the quality of human life, right? Hormone therapy is another thing we can talk about if there are no contraindications to hormone therapy. And contraindications to hormone therapy are really active cancers that we talked about, a history of a blood clot that was unprovoked, end stage liver disease, or if you've had a recent heart attack or stroke. Those are the areas where you should have caution. But family history of those things doesn't preclude you from having that. If you can't have hormones, there are non hormonal treatments to help deal with the symptoms of perimenopause and menopause. And then there's new and emerging research in testosterone showing that it may also be helpful, but we need more information on that. So this was, I'm going to skip over these slides just in the interest of time, but the hormone therapy, diet, and calcium were the things that were studied in the Women's Health Initiative. And these are things that I actually have up on my website for my podcast for what things increased or decreased in terms of risk in the Women's Health Initiative and why. And I have an explanation written for that, and I can provide that link to the group as well if somebody wants to read about that in a little bit more detail. Um, and then here's again what matters at every age. I think finding supportive healthcare providers is going to be the biggest thing. If you find a doctor that or other healthcare provider that listens to you and is doing their best to understand what you're going through, that's going to be your best advocate outside of yourself. Making sure that you're taking care of your mental health is really, really important. There's a lot of stigma around admitting that you're feeling anxious or depressed, but that can really adversely impact your quality of life. Just because you have depression or anxiety does not mean that you're quote unquote crazy or something like that, right? I mean, we're quick to label people, but these are true medical conditions and they deserve care and attention. Making sure that you're getting sleep is important. Managing your nutrition, your physical activity, stress management. It sounds like a lot of repeats, but honestly, these are the things that will support your good health at any age. And then advocating for your health, right? These are questions that I really recommend women ask their doctors. And number one is, what stage of hormonal life am I in? If there's some confusion around that, you can talk to your doctor and get a better understanding of that. Number two is, could hormones explain my symptoms, right? And we today talked about reproductive hormones, but then there's thyroid hormones, adrenal hormones, your pituitary gland in your brain controls all of the other hormones that are ongoing. We have insulin, which is responsible for our blood sugar. So it may not be the reproductive hormones; it could be other hormones that are also going on. And having that discussion with your doctor is very, very helpful. The third one is, what tests or treatments are available for me at this time, right? Because you're going through all of these things. You may be doing the lifestyle pieces of it, but if things are not getting better, there's no harm in asking for testing or treatment. And then for again, like the lifestyle changes, like I talked about, lifestyle is the cornerstone of everything. You cannot out medicate or out hormone poor lifestyle. So if you're not getting good sleep, if you're not following a healthy diet, if you're not moving your body, it's very hard to medicate over that. The medications don't work as well when you're not doing those basic things. So these are the questions that I always recommend women go to with to ask their doctors. Actually, male patients can utilize these as well, right? And then lastly, my key takeaways for today's talk are going to be that hormone changes are normal, right? Every woman goes through hormone changes. We have fluctuations on a monthly basis when we're menstruating. We see that, hormones increase, reproductive hormones increase across our lifetime and then decrease. And with each era of our life, we have a different health outlook or health focus that we need to be focusing on. The most important takeaway for me is suffering in silence is not normal. Please do not suffer in silence because that impacts not just you, but your ability to be able to live and enjoy your life and interact with your family and friends and show up at work in a way that makes you happy and proud. And the stages, understanding the stages of women's health is going to help you recognize your symptoms earlier, seek out the appropriate care, support one another, right? And one of the biggest things that I've one of the biggest blessings that I've seen as I've entered midlife is that I can talk to my girlfriends about this, or my sisters about this, or my mom about this, and they will, provide me with validation to say, this is a normal change and you should maybe talk to your doctor. And then, really, if you're doing all of these things for yourself, you're putting yourself in a position to age with strength and confidence, right? That's going to be the most important thing is like, how are you aging the way that you want to? Are you taking care of your body in a way that's going to give you the best quality of life for the longest period of time? So, with that, I want to um, end my talk with pay attention to your body and ask for help. Ask for help. Happy International Women's Day to everybody, and thank you so much for your attention. And then I have just some my website here. There's a contact page if anybody has questions about resources. I can't give personalized medical advice, but I'm happy to try and answer some questions. And then these are some good resources to learn about women's health that are evidence-based. There's a lot of interesting information on the internet, and so I prefer to go to validated sources like these. Thank you so much.
Yeah, thanks, Dr. Komal. A very, very important session, very eye-opening.
Thank you.
I'm sure there are many teenage girls in the audience, and then, of course, the ladies in either late 40s or early 50s. So definitely, you covered the broader spectrum, and definitely this was a very important session. Uh, I'm so thankful that we arranged
Oh,
this
thank you.
session on the International Women's Day time period. So thank you so much.
Oh,
Let's
it's my
go.
pleasure.
Yeah, thank you again. Thanks for your time. So we'll go through questions. Again, as you mentioned earlier, please do not ask any personal questions. Your questions
Mhm.
should be very generic. That will be safe for everyone. So we will go
Uh,
one by one.
Pras- yeah, Prasad, we have some questions in the chat. I think
Okay,
we
so
should
you want to,
go.
yeah,
Yeah.
let's go with those questions first, and then we will ask people to raise their hand, and then we will go one by one.
Okay, perfect. So I'm seeing in the chat the first question is why are some women still having a period after age 57, right? And that's a great question. I see a big range. I have a patient of mine who kept having her menstrual periods until 62, and she was so upset. She said, "This just needs to stop." Um, Again, with all life, there's some fluctuation, right? No two of us are exactly the same. And so, depending on your history, right, you may have more longevity of your ovaries that run in your family. And so, you may continue ovulating until later. The 45 to 55 is just kind of roughly a range, but there are people who fall outside of that range on both sides. Let's see here. I hope that answers the question. The next question is after postmenopause, there's a lot of talk about peptides for skin and longevity, et cetera. So my thoughts on the peptides is that you have to really approach that with caution. None of those are FDA regulated or studied with randomized control trials. And you don't really know what you're injecting into your body. Those have not been substantiated by evidence-based science, and it makes me a little nervous. I'll be very honest about that. So it's not something that I generally tend to recommend for women, and I actually ask them to exercise some caution when they're looking at it because they can have effects that we're just not aware of yet. Let's see here. The next question is, do you recommend the Dutch test? Any supplements that you feel may benefit women in general during perimenopause and menopause? And so, okay, so I'll start with the Dutch test. The Dutch test is a urine test where they look at the urine and they look at all these different hormone metabolites in the urine. I have read the white papers on that study, and there are not enough patients for me to look at this as a validated test. Plus, there are so many random hormone levels in there that I'm not sure have any true clinical impact because it hasn't been studied. It's not something that I recommend. It is prohibitively expensive. I've seen it be as much as $2,000. And I think the amount of money that you get is extremely limited. Like we looked at in the diagrams that I had, the hormone fluctuations are so up and down. Trying to use a test to pinpoint just one point in time with something like a Dutch test, it doesn't give you the whole picture, and you end up spending a lot of money without a lot of answers for that. So that tends to be my thought around that. I would say save your money. The symptom assessment is actually much more helpful. And we're doing more research. And so the answer I give you today may be different in 5 years, right? Because if there is a new technology that comes out, or all of a sudden they validate the Dutch test, but based on today's data, there's no widespread use of the Dutch test in the evidence-based medicine setting. And then in terms of supplements, I think this is a great question, right? A lot of our Desi population tends to be vegetarian or vegan. And so I think B12 is actually very helpful because we don't get it. B12 comes mostly from animal protein sources, right? Sometimes if you're eating enough eggs, you can get it if you're a vegetarian, but if you're vegan and you eat really no animal products, a B12 supplement can go a long way. I live in the Pacific Northwest, so being here in Seattle, I think everybody should be on vitamin D just because we're all vitamin D deficient. And really, if you look at the general population of the United States, most of us tend to be vitamin D deficient. So, for postmenopausal women, for the purposes of bone health, I actually recommend most people be on 1,000 to 2,000 international units of vitamin D3. That's what I tell my patients to help their bone health. And then calcium is actually very important as well. Calcium is important to get reintegrated into your bone, and the calcium. The recommendations that we have is that calcium is better absorbed through your diet and the foods that you're eating than through supplements. So if you get 2 servings of dairy a day, like you have a cup of milk and you have a cup of yogurt, you've already got all of the calcium that you need for a day. But if you can't have dairy, or you don't like dairy, or you don't really get a lot in your diet, taking between 1,000 to 1,200 milligrams of calcium per day, in addition to that vitamin D, is really good for your bone health. And then anything else, I only recommend if you truly have a deficiency. There's a lot of talk about biotin. Biotin is one that women take without really thinking about it. And it's interesting because it's supposed to be for skin, hair, and nails, but the study that was originally done to look at biotin supplements was done looking at, they gave it to horses to see if the hooves of the horses got thicker. And there are actually no studies in humans to show that that actually helps with skin, hair, or nails. And the downside of biotin is it interferes with a lot of lab tests. So, for example, it can make your thyroid test look abnormal if you're on biotin. The two scary ones for me are that if you go into the emergency room and you're having chest pain and you think you might be having a heart attack, the biotin can interfere with the assay that they do, the blood test that they do to look at whether you're having a heart attack. So that test may come back falsely negative and you may miss that. So biotin is not my favorite. I don't think it really adds anything. But that's my thought on supplements. A daily multivitamin is not a bad thing, but I don't think it's necessary if you're getting a lot of your nutrients through your diet. And thank you for all the lovely compliments in the chat. I really appreciate that. I'm glad it was informative and helpful. Let's see here. There's a question. Are there support groups for mental health focusing on the Indian American population? That's a good question. My sister is a therapist, so I will ask her. I don't know specifically. I know locally there are some therapists in the area that I live in that focus on Southeast Asian families for mental health support, but I don't know about any like more national or broad spread organizations, so I can figure that out. And then I have here, can you talk a little bit more about metabolic syndrome and metabolic disease? I would love to. I think that is almost a whole other hour talk in and of itself. But my quick breakdown of that is, especially in women's bodies, when we go through menopause and our hormone levels decline, because we're gaining that extra fat mass, right, to try and preserve some estrogen in our body, the weight gain that happens generally tends to happen around our midsection, right? And when we gain weight on like our arms or legs, that fat tissue goes and sits under the skin. And that is not as inflammatory as the fat that goes in our midsection that actually goes inside our abdominal cavities. And so that fat is what we call visceral fat. That visceral fat that we gain in midlife is what is increasing insulin resistance, is changing our cholesterol, and is putting at us at risk for higher blood pressure. if if the group is so kind as to invite me back, I'd be happy to do a full talk on metabolic syndrome. But that's my quick breakdown there is like really if we can impact that visceral fat weight gain and work on losing that, which is really some of the hardest weight to lose, we can see some improvements in metabolic syndrome. But yeah, I appreciate the question, and I think that it deserves more time than my 5 to 10 minutes. Let's see here. Thank you so much. I just want to make sure I'm not missing any. Okay, so there's a question. How do we control our muscle loss? This is an excellent question. So there is data that shows 3 10-minute strength training sessions a month helps maintain your muscle mass. Anything you do above that is actually helping you gain a little bit of muscle. And that muscle is really impactful on improving your bone health. We, as Desi women, are at higher risk for developing osteoporosis compared to our other ethnic counterparts. Our bone density is lower than women who are Caucasian, who are Black, who are Latina. We have a lower bone density, us and Southeast Asian women in general. And so that strength training goes a long way. The other thing is getting enough protein, right? Most women should probably be getting at baseline minimum around 80 grams of protein per day, which is a lot. And it's hard when you're vegetarian, right? But there are protein supplements in the forms of like vegan protein shakes or eating tofu, eating lentils, adding chia seeds. You can create that. Cottage cheese is another really good source of getting vegetarian protein in so that we can help control that muscle loss. Um, Let's see here. Do I recommend vitamin K2 along with D3? I'm plus minus on the K2. The studies for vitamin K2 for bone health were done actually in a prescription formulation that's not available in the United States. And our supplements are not the same dose as what was studied in that study, and it's not available here. So taking that vitamin K2, I'm like plus minus on that. So let's see here. What else? Oh, my pleasure for answering the Dutch question. Let's see here. Yes, so I think I just said consumption of beans and lentils is excellent for building muscle mass. Why do you get more pain in the night if you have osteoarthritis? What to do? So, the pain that we see with menopause is musculoskeletal syndrome of menopause. We see kind of a breakdown of the tissue in the joints, in the muscles, and the tendons and the ligaments, and that can actually cause some issues there and create more inflammation in those areas. And I'm not sure why the pain escalates at night so much. And I think we need to do more studies around that in order to say. And then let's see here. There's another one, role of dietary GMOs and hormonal changes. I think this is a great question. This is an evolving area where we don't have quite as much data just yet. But, one of the things that I can talk about is that in autoimmune disease, right, understanding how genetically modified wheat it can impact autoimmune conditions is important, right? A lot of the wheat that we use in the United States has been genetically modified to create 3 to 4 more times gluten. And that is very inflammatory. And so, just in disclosure, I have an autoimmune arthritis called psoriatic arthritis. And what I've found is that gluten really impacts me or the quality of the gluten. So I can eat the non-GMO bread, like Dave's Killer Bread, for example, is a great one that is made with non-GMO wheat. That doesn't bother my joints. But if I'm not careful about what I'm eating outside, it makes my joints hurt, right? And I know that that's part of that autoimmune cascade, and my rheumatologist and I have talked about that. So I think just being aware of that and doing your best to try and get those non-GMO food sources can be helpful. And again, that's a role of emerging data, or that's an area of emerging data. And I think we'll know more about the role of that in the future. Let's see here. What was the strength training recommendation you mentioned? So 3 10-minute sessions, so total of 30 minutes a week will help you maintain your muscle mass. And there are some great online programs. There's one that's actually free called Senior Strength. So if you go to, I think it's seniorstrength.com, I'll pass along that resource as well. Um, I think that that is really a great one to do, and it's welcome. It's open to all levels, right? So if you are able to, if you're only able to, you've never done strength training and you want to start, but you're afraid of your balance, you can actually do some of these moves just sitting in a chair and being supportive. And then as you build up your strength, it can help improve, over time for your muscle mass. And then there was a question how to improve on osteoarthritis. That is a harder one to answer, right? With arthritis progression, we see that it rapidly increases postmenopausally. For some women, they actually get some relief with hormone therapy. So if you're in a period of your life where you are considering hormones and you're noticing those symptoms of osteoarthritis, it's important to go talk to your doctor and see whether a trial of that would help, provided you don't have any other contraindications. Um, Yes, I will. Let me see if I have to stop sharing so I can find it, but then I'll put it in the chat here for the senior strength. And then let's see here. There was a request for talking about bone health and postmenopause. And that is another topic all in and of itself that could probably be another hour-long talk. I do have some episodes on that on my podcast, and I can put that link in here as well. But really, what happens is as our estrogen and progesterone levels decline, our bones stop remodeling appropriately. And we have two types of cells that are in our bone, like ones that are eating up the old bone and another set that are laying down brand new bone. And what happens in menopause when the estrogen goes away is the ones that are eating up the old bone keep going, but the ones that are laying down new bone really slow down. And for some women, if you catch it in the time right around menopause, hormone therapy, and you have osteopenia and not osteoporosis, it can help prevent that progression to osteoporosis. So hormone therapy is approved for that indication. But if you're past that stage, there are other medications that kind of help slow that process down or help build bone back up. But, strength training, calcium, vitamin D, and then, making sure that we are looking at all the appropriate hormone therapy options versus non-hormonal therapy is going to be very important. And I wish I had more time to go into that, but that I think is very important for overall health. Let's see here. If you're 70, then what to do? That is a great question. If you're 70, then and I'm assuming this is in question to the osteoarthritis. A lot of it will focus on pain control, strength training, going to, if you have osteoarthritis that's affecting your knees, for example, there are like injectable injectable solutions they can put in the joint space to kind of help cushion the joints and help avoid surgery. But if the osteoporosis has progressed to the point where it's affecting your ability to walk, then talking to an orthopedic surgeon to see what options are there is kind of the next step. Because once it's progressed, it's very difficult. I don't think we have anything to be able to reverse it, right? So it really depends on what stage you're at for that. Let me see here. I'm looking for the senior strength link that I can pass along. Sorry, it's called Senior Shape, is what it's called. And there's a YouTube channel as well as their main website that also has links to that. But this is a very good program that you can do at home. And then I'll put the YouTube link as well. Oh, that's so wonderful that you knew my mom. My mom is the best. She's on this call today, so I appreciate her support. That's really wonderful. And then let's see here. I think there's one other question. Vitamin C, K2, and magnesium glycinate is equally important. My question is which good brands are available on Amazon or Costco and how much serving do we need to take? I actually don't recommend vitamin C regularly to my patients. I honestly think that you can get good ones at Amazon or Costco. I like Nature Made or Nature's Bounty tends to be the two that I gravitate towards because I like their manufacturing process. There are some people who also really like the Thorne pharmaceuticals. I think you can find good ones no matter what your price point is. You don't have to spend a lot of money on supplements. There are good brands that are at good price points, but really Nature Made, Nature's Bounty at Costco. I'm a big Costco fan, tends to be my favorite. Yes, I will happily share my podcast link. Oh, my pleasure. Let's see here. And there's my podcast link. Okay, perfect. Any other questions? I know we are very behind. Oh, here we go. Bone spurs and menopause. Yes, that is part of osteoarthritis. So it's not uncommon for women, especially since we know osteoarthritis accelerates during that time. It's not uncommon to get bone spurs during that time. So, all right.
Perfect.
Thank you.
Thanks,
Yeah.
Dr. Komal. And of
Oh,
course,
my
let me ask
pleasure.
the audience if they want to ask in person. I mean, raise your hand and we can unmute you, and then you can still ask the question. And before we start that, we would like to thank your mom also. What a
She's
young, bright child she has raised. So thank you so much,
thank
Jayaji.
you.
आणि छान वाटलं की सेकंड जनरेशन डॉक्टर्स आता आपल्या बीएमएम इनिशिएटिव्ह मध्ये येत आहेत आणि खरंच कौतुकाची
No,
गोष्ट आहे. सो
मला
थँक्यू
पण
सो
बरं
मच.
वाटलं. I want to be able to support our community as much as I can, even with my Mordka Todka Marathi. So thank you all for the
That is good.
opportunity.
And this is how we want to invite
Yeah,
our next generation kids on our BMM
yeah.
initiatives, right? Because you are the guys who will take this BMM to the next level. आमच्या नंतर you are the second in line. So
Well, thank
thank you
you.
so much.
I really
Yeah,
appreciate it.
thank you. कुणाला प्रश्न आहेत? Please raise your hand. Jayaji, if you want to say something, please feel free. गौरव जर अनम्यूट करायचं असेल सगळ्यांना तर करू शकतो.
हा जयाजी मला एक मिनिट.
जया पाटील. अंजली ताईने हात वर केला.
जयाजी तुम्ही अनम्यूट करू शकता तुम्हाला आता. मी रिक्वेस्ट पाठवली आहे त्यांना पण
ओके.
Yeah, we were
That's okay.
having a
Let's.
little bit of problem with her Zoom earlier today,
ओके.
so
Yeah, no worries.
Let me I think Anjali's hand is raised once again. Yes, go ahead, Anjali.
Mm, what I would like to suggest the host of this show is whatever they are posting on the chat, how do we access that? Because we don't get the copy of the
that's a great point.
this meeting, but then once we are off the meeting, we won't access whatever the information they are giving us. How would we be able to do that? If
Okay,
you can
so
tell me.
sure. Thank you, Anjali Tai. So what we can do is we will pause the recording. Usually we do, and if still there are questions, you can just contact us and then we will provide that. But whatever is shared here, we will compile and put it on the website. That way you can refer it later. गौरव आपण
So,
करू शकतो राईट ते म्हणजे
yeah. सो प्रश्न आय मीन तुम्हाला चॅट हवा आहे की रेकॉर्डिंग हवा आहे म्हणजे बिकॉज रेकॉर्डिंग आपण प्रत्येक शेअर करतो बट इफ यू नीड स्पेसिफिकली द चॅट हिस्ट्री वी कॅन ऑल्सो शेअर दॅट इफ यू रिअली नीड दॅट.
Thank you. But a recording will be available. That's for sure. Thank you. गौरव नेक्स्ट कोण आहे? सुरेखा ताई आहे.
Yeah.
Go ahead, सुरेखा ताई.
नमस्कार. मी सुरेखा म्हणजे ऐकतोय मी फक्त एक क्वेश्चन आणि कॉमेंट सियाटलला आल्या मॅडम तर चांगलं होईल अधिवेशनात. आय थिंक शी कॅन कॉन्ट्रीब्यूट अ लॉट इन द हेल्थ सेगमेंट अँड द अदर थिंग वॉज अबाउट फायटो एस्ट्रोजन फ्रॉम soybeans and tofu. What is it? Is it okay?
I think it should be okay. We do recommend that for, and there are supplements that are available that some women will take because they don't want to take hormones. I think, the dose is, or the amount is so low in those things that it can sometimes help with symptoms. Sometimes it doesn't make a huge difference for women. But I have a friend of mine locally here. She is an American physician. She wrote a book called The Menopause Menu for some dietary strategies that can help with reduce the symptoms. And her book is available on Amazon. So I'm happy to put that link in there. But she does incorporate some like soy and tofu into that. She also has some very like antioxidant heavy food recommendations and things like that to help with some of those symptoms. So I think it can have an impact for some people, but it doesn't help everybody.
Yes, ma'am. One more question
Yeah.
Sureka may have about her family history. I don't know if she wants to.
No, no, no. I'm okay. Thank you so much.
Yeah,
Thank you. You
of
you
course.
answer so many questions that I am at rest. It's okay.
Okay.
You know?
Okay.
Okay.
Well,
Thank you.
thank you. It's my
Thank
it's
you.
my pleasure. I'm happy to help.
Yes, thank you. You are making a lot of women aware of their health, and this is so
Ah,
wonderful. Thank you so
thank
much.
you. That
Thank
that's the
you.
goal. That's the
Yes,
goal. So thank you
thank
for the
you.
platform today. I really appreciate it.
Thank
Yeah.
you.
And by the way, Dr. Komal will be leading the BMM CME session. So if you're coming to Seattle convention, you will see her there. So yeah, thank you. Okay. Next is Nivi.
Namaskar, Dr. Komal. My name is
Namaskar.
Nivi
Hi, nice.
Panolkar. I am Prasad Panolkar's wife. Now I'm telling you, I was the one who talked about the Dutch test. So
Yeah.
तुम्हाला खूप खूप धन्यवाद आधी आणि our son is in kind of same not kind he's in the same field and I see him in you 10 years from now.
Thank you. That's so nice.
Really, and I'm so glad that you brought it out in the open. But I just had a suggestion. If it comes from the doctor that Prasad is a very feminist husband, he's extremely supportive, etc., and
Yeah.
so on. But this perimenopause and menopause was such a stage in my life, or is, that I'm very expressive, but there were things I could not express for the
Mhm.
longest time, and I had all those symptoms. Disclosing it for everybody else's,
Yeah.
health, so that they can benefit from and don't reinvent the wheel. I feel family support is of paramount importance, and
Yes.
people do not know about this. People
Yes.
just do not know. Our family is athletic, and my husband is a health freak, Iron Man, etc.
Yeah.
He's my health coach. Do so many triathlons. We
Yeah.
do, but it did not help. I
Yeah.
had to go to the physician, but I
Yeah.
had to explain to my family and my kids what was happening to me,
Yeah.
because no matter how expressive you are, there are things like you said. I was one of those. I do not know what's happening, and there was one more sentence that I kept saying to everyone and the physicians too, that this is not me. There are times when it's not me, and I know that it's that somebody else is walking out of my body and doing this, and I cannot control it. So do you have any suggestions for this for families? Because if I did not have my family support, I would think I was lunatic. It
Yeah.
was difficult.
I thank you so much for sharing that story. And I think this story is so common, right? I'm a physician and I was confused for a small part of my health journey before I started piecing together what was happening to me, right? And now, I think the importance is we can't be embarrassed to talk about these things, right? This is a natural change in our bodies. And my son, he's 14 now, and he says to me, Mom, I know more about menopause than I ever wanted to know. And I said, you know what? I'm training you to be a good husband in the future, right? That's what we have to do. We have to talk to the men in our lives, we have to talk to the other women in our lives, and we have to just keep talking about it, right? Because it is something that, again, like I showed with that one graphic, is we go through more hormonal changes in that 28 days to have a period than a lot of our male counterparts do in a lifetime, right? I mean, I think the exception is people who have gone through, like men who suffer with low testosterone or who have gone on hormone deprivation therapy for things like prostate cancer. They understand. And a lot of them actually come to me and say, oh my God, I now know what my wife was going through with menopause. It's terrible. Like, how do you guys do this, right? So really, it's just normalizing the conversation and not being afraid to have that conversation. And it's hard because it really requires a lot of breakdown of cultural norms, right? I remember when my sisters and I were growing up, right? There was we were always told when you're on your period, you don't go into the temple room, right? You don't go to do namaskar, you stay out of the room entirely. And my sisters and I could never understand why. And we asked our family friend who actually, I think he officiated two of our weddings. But he said to us, he said, this started as a thing to protect women because women, when they're on the week of the menstrual cycle, they are actually in pain, they're bleeding, they're tired. So the whole reason this started in our culture was so that they didn't have to go do all of the puja preparation. They didn't have to do all of the work that was associated with that. It was to give them a period of rest. And unfortunately, over time, it's twisted into something that you're unclean, you can't go there, you're not worthy of being in front of all of the murtis and things like that. So we have to normalize the conversation and say, there are pieces of our culture that appreciated and honored women and what their bodies were going through, and we have to take that power back. So I think that's going to be mostly through conversation and presentations like this, where we can normalize it for people, and and make sure that girls know that their bodies are not, unclean or crazy or going through these changes that nobody else and understands, or that it's their fault. This is natural physiology, right? And we have to make that normal. So I'm so glad that you are advocating so strongly with your voice, and that you talk to your family and you have such a supportive family and partners. And I think the more that we can cultivate that in our homes, that degree of understanding, it not only helps women, it really helps all of us, right? Because it cultivates a sense of being kind, compassionate human beings to everybody you come across with, not just women or not just men, but really everybody. So thank you for saying that. And thank you for sharing your story.
Thank you
Yeah.
so much.
Yeah, thanks, Nimi, for bringing it up. And as I said earlier, after your speech, like it was very eye-opening for me because
Yeah.
here, Nivi, she's in pre-menopause, menopause stage,
Yeah.
and my daughter, who is a teenager, right? So we have two different females in home going through different set of
Roller
cycles, right?
coaster, right?
Yeah. So and but yeah, very important. I'm hoping the fathers in respective house will talk with their wives and understand better
I
after this session. So definitely it will be helpful.
Yeah, I really hope so too, and thank you for being such a great ally, right? I always say it's important for us to find people who are, what is the saying? He for she, meaning men who are supportive of women and what they're going through, right? Because there is an inherent bias, I think, towards men in general, right? Where women are not given the same opportunities. So it's really refreshing to see men stepping up to the plate in support of women. So thank you for doing that also, and
Yeah.
being
And
such a
then
great
in
advocate.
Marathi we have a saying like "Stri janma hi tuji kahani." That means like a
Yeah.
woman, womanhood, and it's
Yeah.
like we are bowing to you. So
Oh,
it's
I love
very
that.
important.
Yeah, we
Yeah.
need to bring that back.
Okay. Who is next?
Shailaja.
Shailaja.
Hello.
Hi.
Hi. I want to first of all thank you, Dr. Komal, for doing such a wonderful session and such an important topic.
My
I'm really,
pleasure.
really happy, and Prasad also for arranging for BMM to arrange this. This was very informative, and you did really excellent job. I'm very proud
Thank
of you.
you.
And I just found my childhood friend here,
Yeah.
your mom,
Yes.
and then we didn't keep in touch with, but I guess when I saw that name, I said, "Oh, I know her."
Yeah,
So
that's
we went to same
wonderful.
school in Pune, Kanya Shala.
Oh, that's wonderful. That's wonderful. And I hope you get a chance to connect outside of this call. I know that
Yes,
it's
yes, I
such a
wanted.
special thing to be able to reconnect with childhood friends.
Yes. So what a nice thing. Thank you.
Thank
And
you. I really appreciate that.
congratulations. You did excellent
Thank
job.
you
We are
so
very
much.
proud of you.
Thank you. I really appreciate that.
Next is Pallavi. Oh, Pallavi, sorry.
Bhavatayi, तुम्ही अनम्यूट करू शकता.
Uh, just accept my request one.
Okay, next,
Yeah. The next is Vidita.
Geeta. Yeah.
हॅलो, नमस्कार. मी
Namaskar.
सोनिया केसकर. मला आजचं सेशन खूप खूप आवडलं कारण तुम्ही खूप छान प्रकारे सगळ्यांना गाईड केलं
Thank
आणि
you.
युअर सेशन वॉज रिअली इन्फॉर्मेटिव्ह. I want to share my first-hand experience with postpartum depression.
Yeah,
There is a taboo about that in Indian, like American
absolutely.
community. And if there is another session or another informative um, lecture arranged on that, just to speak up so other ladies can come out and open up or share their experiences, because we are away from here, from our homeland, and we necessarily don't have enough resources to talk about. So if there is such group uh, to talk about mental health issues after pregnancy, that will be really helpful. And I'm really thankful for my husband, my family, and my daughter for the tremendous support they have given me throughout this journey. And I would really appreciate if you address that somewhere in BMM or through this platform. And it was a really wonderful session. Thank you very much.
Oh, my pleasure. Thank you so much. Actually, I would suggest my sister, my youngest sister, Neha. She is a marriage family therapist, and actually, she's written several articles about postpartum depression and the mother wound and things like that. And that is an area that she's very passionate about. So I will put a link to the article that she wrote for Newsweek magazine in the chat. And then I think, I can, Prasad, that I can connect you with her later because I
Right.
think she would be the right person to give that talk. And thank you so much for sharing your experience. I'm sorry that you went through that. It is such an isolating time after you go through childbirth and all of those things. And then you feel like you're not able to connect with your baby or be able to function in your family the way that you want to. So thank you for being vulnerable with that and sharing that
Yeah.
with everybody.
Yeah. I just want to share,
Mhm.
like, through proper medical support and through the counseling sessions, it
Mhm.
can be uh,
Yes.
like it can be changed, and you can go forward though you have those conditions.
Yeah.
So thank you so much for giving me this platform to talk about it.
I'm
Yeah,
glad.
आणि
Thank you for sharing.
या विदिताताई, आम्ही जेव्हा हे आरोग्य संपदा सुरू केलं ना, सो वन ऑफ द आयटम्स वॉज दिस की बऱ्याच वेळा काय होतं, उत्तरंगामध्ये डायबिटीज, ब्लड प्रेशर आणि ते सगळे टॉपिक डिस्कस केले जातात, पण नो वन टॉक्स अबाउट दिस इम्पॉर्टंट टॉपिक, राईट? चाइल्ड बर्थ, पोस्टपार्टम अँड ऑल दोज थिंग्स. तर आमच्या कमिटीत डॉक्टर मेधा गोडबोले, तर त्यांची ही सजेशन होती, एक्झॅक्टली जो तुम्ही आता पॉइंट मांडलात, की these topics which are very important, but there is no platform to express or discuss, right? So definitely, I will arrange a session particularly to this topic. आणि बघू, तुम्हाला नक्की फायदा होईल आणि अनेक न्यू मॉम्स आहेत त्यांनाही फायदा होईल. सो या, वी विल डू
Thank
इट.
you so much.
थँक्यू.
Thank you.
नेक्स्ट पालवीताई, तुम्ही अनम्यूट करू शकताय का?
एक मिनिट,
If
मी
not,
अरुणानं रिक्वेस्ट पाठवली आता.
go ahead, Arunataई.
Can you hear me?
Yes,
Yes.
I can hear you.
Yeah. मला मराठीतली अजून एक म्हण सुचली प्रसादचं जेव्हा ऐकलं तेव्हा, जावे ज्याच्या वंशा तेव्हा कळेल. सो
Yeah,
मी
that's right.
सुचवायचे ते. आणि जो पॉइंट होता ना की पूर्वीच्या काळी, तर त्याला मी ऍक्च्युली मला असं वाटतं की इन महाराष्ट्र देर वॉज अ ट्रॅडिशन की जेव्हा तुमचे पिरियड्स असतात तेव्हा तुम्ही 4 दिवस यू आर नॉट अलाउड इन किचन और समथिंग लाईक
Yeah.
दॅट. I actually think that should come back. म्हणजे that will be a compulsory
Yeah.
rest. Yeah, I really think
Yes.
that will be really helpful if we bring that back and like families are definitely supportive. Absolutely no question about that. But it will be really helpful if that tradition comes back and then it's like compulsory. Yes, compulsory rest. So that was I wanted to share.
Absolutely.
Yeah, that's a
Thank
good
you.
suggestion. And of course, my husband should, our family members, like if you have grown-up kids, they should support mom if mom is going through that phase, right? I mean, it comes
Yeah.
down to that. So, yes.
Exactly. And in US, usually husbands are very supportive. म्हणजे मी तरी जेवढं बघितलंय लग्नानंतर डायरेक्ट इकडे आल्यामुळे. बट इन इंडिया ऑल्सो इट्स रिअली इम्पॉर्टंट दॅट इफ वी रिअली give that rest of 4 days. That will be very helpful.
I
But
agree.
another thing, I joined late. I joined when you said that the वेळेचा जरा घोळ झाला. 10 Eastern. I'm in Central Time Zone, so sorry
Oh,
about that.
okay. No, it's okay.
But I will definitely go through the recording. This topic was very interested. So we have, I had it bookmarked. I forwarded it to a couple of our friends also. So I will
Thank
definitely go
you.
through the recording. Thank you for sharing. Thank you for your time. I know I
Thank
missed the great session, but I promise that I will go through the recording.
thank you so much. I really appreciate that.
Thank you, Raj.
Okay. Next, I don't know, Pallavi, I think Aslesha.
Hi Komal. This is
Hi.
a really great session.
Thank
I
you.
have one question.
Yeah.
Basically, I started doing hiking since last 5 to 6 years, and many of my friends who are into 40s to 50s,
Mhm.
each and everyone is getting plantar fasciitis
Yeah.
due to this hormonal changes. So I have a question. Does this go away sometime or we just have to leave it like that with that?
I think that's a good question. I think for some women, there's lots of different causes for plantar fasciitis, but it does get worse peri and postmenopausally because of that hormone level decline, right? And that is part of that musculoskeletal syndrome of menopause. Some women actually get benefit by talking to their doctors and maybe starting some hormone therapy. But in general, for any plantar fasciitis, it can take a long time. Like I broke my foot in 2018 and I developed plantar fasciitis that lasted almost 9 months at that time. And for that, a lot of times doctors will recommend freezing bottled water, rolling your foot on that, taking anti-inflammatories like ibuprofen or naproxen. One of the things that I did for myself was I purchased a foot splint on Amazon and I wore that every night while I was sleeping for like 9 months before it finally started to go away. And I think doing those things plus having that conversation around whether hormones or PT or anything else will help is very important. But a lot of times it can take several months to resolve, so it's hard to say whether it will go away in everybody. And some people develop it chronically where it just flares depending on what they're doing. The other thing, I know we have some great podiatrists in our community as well. There are things that you can do with orthotics in your shoes or getting the right types of shoes in order to support the foot so that the plantar fasciitis doesn't get worse. So I think a
Okay.
lot of different options.
Yeah. So after doing all that options,
Yeah.
still it doesn't go. And people
Yeah.
want to go out and explore themselves. So does it add more complications in that, or they can just do with the mild sessions or, mild hiking and such kind of things?
That I would defer to a physical therapist or a sports medicine doctor because the thing is that I still want people to be active, but I don't want them to be active when it's causing them pain, right? So sometimes changing the difficulty of the hike or doing a flatter hike may be something that you still get the joy of hiking, but you're not doing things that are as strenuous, right? But still moving your body, moving your muscles, things like that. But then I think just looking and seeing if there are other activities that don't aggravate the plantar fasciitis as much, because rest is part of it. And if it's not going away with all of those interventions, sometimes changing the activity type can help.
Okay. Thanks. Thanks for your advice.
Yeah, no, my pleasure.
Next is Kalas.
Kalas.
Hi,
Kalas.
I'm Sonia Burkule, by the way.
Yeah.
First of all, thank you, doctor. Thank you very much for this informative session.
My pleasure.
Yeah, two things I have. I was going through your blog, the list website, and I couldn't go through each and every one right now just by the title.
Yeah.
I wanted to see if you have any particular blogs, particularly for the teenage girls. Because
Oh, yeah, that's a good question. That is something I have in development right now. When I started my podcast like a year and a half ago, I was focused more on midlife women's health. But there is I will be hosting a webinar at some point with a local woman here who works, she's a therapist who works with teen girls, mostly around like the drama that they have at school and things like that, and like the mental stresses that they go through. But we're going to do a joint session where we talk about all of the different hormonal changes and things like that. And then I'm working on developing some things for adolescents. I'm an adult endocrinologist, so I can talk about those things, but I don't treat people in that age range. Really, the youngest patient I see is 16. So there is a little bit of overlap, but I will try and make sure I get those resources to the BMM team to distribute to the group.
and then if there could be a session with teenage kids, girls,
Mhm. Yeah,
like when I think someone was talking earlier about like
yeah,
how stressful the situation goes through when the teenage.
yeah.
So that would be helpful. Thank you for that.
Oh, my pleasure. I'd be happy to help with that.
Right. Next is Bhavna.
Hello, can you hear me?
Yes, I can hear you.
नमस्ते कोमलजी. मी
Namaste.
1-2-3 मिनिटं फक्त वेळ घेते तुझा. पण मी तुला म्हणते तू, कारण की तू यंग आहे खूप. मी 74 वर्षाची आहे. म्हणून मी तुला अरे-तुरे करू का? हॅलो?
Oh, sorry, I didn't hear that last part.
नाही, मी म्हटलं मी
She's
तुला अरे-तुरे करतेय, तर
Oh,
मी
thank you.
74 वर्षाची आहे. तुझ्या आईच्या वयाची पण कदाचित तिच्यापेक्षा मोठी असेल. तर मला एवढंच सांगायचं, मला भयानक अनुभव आला
Thank you.
मेनोपॉजचा. त्यावेळेस म्हणजे 40-42 वर्षाची मी होते आणि मला अजिबात समजून घेणारं कोणी नव्हतं माझ्याबरोबर.
I'm
पण
sorry.
अगदी भयंकर इतका त्रास झाला. माझी मुलं लहान-लहान होते त्या मोमेंटपासनं ते एकदम मॅच्युअर झाले. म्हणजे दे वर टेकिंग केअर ऑफ मायसेल्फ सो मच, व्हेरी मच. आय वॉज स्टँगल इट. अँड माझ्या नवऱ्याला अजिबात काही कल्पना पण नाही. कधी त्यांनी विचारला नाही. 2 वर्ष लागले मला. तर मी काय करायची, मुलांना हर्ट करण्यापेक्षा मी नोकरी करत होते. शाळेत शिक्षिका होते. 35 वर्ष नोकरी केली मी शिक्षिकेची. तर मुलांच्याच भोवती होते ना. तर म्हणजे काय झालं, मला इन सबकॉन्शियस माइंड मुलांचाच आधार मिळत गेला मला. मुलांनीच आधार दिला म्हणजे त्या यंग वयामध्ये. आणि तेव्हा मी काय करायची, की दिवसभर कामावर असायची तर मला काही त्रास व्हायचा नाही. घरी आली, घरात पाय ठेवला, की मी स्वतःलाच इतकी बडवून घ्यायची. आणि मलाच माहित नव्हतं, की मी कशी कंट्रोल करू, म्हणजे स्वतःलाच मारायची. मुलांना नाही. तर मुलांना एवढा धाक वाटलाच होता, की मी शाळेतनं घरी येईस्तोवर सगळ्या वस्तू ज्यांनी मला हर्ट होईल त्या ते खाली बेसमेंटमध्ये नेऊन ठेवायचे. 4 आणि 10 वर्षाचे मुलं होते माझी त्यावेळेस. तर ते मला सांगायचं, की आज तू इतकं सविस्तर माहिती दिलीस. त्यावेळेस मला तर काहीच माहित नव्हतं, की इव्हन माझ्या शरीरात मला काय होतंय देव जाणे. उलट टक्के-टोणके खात नवऱ्याकडनं विचित्र वागणं, बोलणं ऐकून घ्यावं लागलं. आता माझ्या लग्नाला 51 वर्ष झालेत. पण मूव्ह अराउंड, मूव्ह आहे आणि सगळं काही आता ठीक चाललंय. पण मला एवढंच तुला धन्यवाद द्यायचे, की तू इतकी सविस्तर माहिती माझ्या आत्ताच्या पर्यंतच्या आयुष्यात कधी मिळाली नव्हती मला. ती मिळाली. म्हणून
Thank you.
धन्यवाद. म्हणून
Thank,
धन्यवाद.
thank
ओके.
you. I
आणि खूप खूप हार्दिक शुभेच्छा तुला पुढच्या प्रवासासाठी.
thank you.
So,
That's
Bhavna
so
ताई,
kind.
तुम्ही
She's gonna
तुमच्या
make me cry.
हो
सो
ना, खरंच मी खूप 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 हार्ड टाइम झाला माझा. म्हणजे ट्रॉमॅटिक सिच्युएशन म्हणजे.
I'm so sorry.
पण
येस.
दॅट्स गुड की तुम्ही तुमच्या भावनांना आता मोकळीक करून दिलीत. इट्स ऑलवेज
आणि
गुड टू ओपन अप अँड एक्सप्रेस युअरसेल्फ.
फारच
ॲटलीस्ट ते
छान.
लोड
आणि मला
तुमच्या
हा हा प्लॅटफॉर्म मला मिळाला. मी कधीच कुणाकडे एवढी बोलू शकले नाही. आणि माझं नावच भावना आहे. सॉरी अबाउट दॅट. मी
Oh, no, it's a
इमोशनली
नो
कॅरीड अवे
th-
झाले मी.
नाही नाही थँक यू तुम्ही तुमची स्टोरी शेअर केली ना तर
येस.
आय थिंक सगळ्यांना त्याचा बेनिफिट येतो ना हे
आणि
सगळं आपण
मुलगी पण नाही ना, मैत्रिणी इतक्या क्लोज नव्हत्या. इथे मी यंग वयात आली. एकटीच होती कायम म्हणजे. त्यामुळे त्या काळात तर कोणीच नव्हतं. इथे आपले लोक सुद्धा 79, 80 मध्ये नव्हते एवढे. आमच्या एरियात म्हणजे कनेटिकटमध्ये. माझा नवरा स्टुडंट्स म्हणून येलमध्ये म्हणून आला. त्याच्याबरोबर मी आली. तेव्हा माझा मोठा मुलगा 15 महिन्यांचा होता फक्त. सगळं एकटं केलं मी इथे. चालायचंच. चला, हे नशीब
सो मच.
हेही नशीब तुमच्यासारखे लोक मला भेटले ना. ऋणानुबंध. यस. चला, धन्यवाद. धन्यवाद.
थँक्यू.
थँक्यू
अंजली ताई, नेक्स्ट.
Anjali Karode, you're asking. There are so many Anjalis there, so I just wanted to make
Go
sure.
ahead.
Okay, quick question. Thank you so
Yeah.
much. I
Oh, my
thoroughly
pleasure.
enjoyed. I just got the link 5 minutes before it started, which I was lucky. I have a quick question because I had a lot of menopause symptoms. I'm right now 73 years old. Menopause issues, hot flashes. My period ended at the age of 62.
Okay.
And I still have issue with my sleep. So do you think it is, so I can talk to my doctor accordingly? Because I'm lost with so much information I'm reading.
Yeah.
So how do you, because
That's
my grandmother has sleep issues too. So
Yeah.
I thought it is inherited.
Yeah,
But
what I would say is I would ask your doctor to send you to a sleep doctor, right? Because a lot of times, yeah, my middle sister, she's a TMJ dentist, right? And what she finds is that a lot of women, especially postmenopausally, even if they don't look like it, they've developed sleep apnea, and that sleep apnea makes their TMJ worse, but it also impacts the sleep. So seeing a sleep specialist to have all of that evaluated properly, that can help significantly with sleep. So I
no,
would,
that was done. That was
oh, that
done.
was done. Okay, good.
That was done. They couldn't find it. Then they had like a monitor for 3 weeks. So they can monitor long period of time.
Yeah.
So the problem is they are not unable to find with so many tests. And my doctor is very, even yesterday I went for my checkup and I mentioned, and she said, I'm going to try to see the other side, how I can go through. But is it just me 5 hours sleep? And she said, that's not good. Even my doctor agrees, you know what I'm saying. So anyway, any suggestion which I can go further?
So I have a colleague of mine. Her name is Dr. Andrea Matsumura. She's actually a sleep specialist who specializes in women's sleep in particular. And so what I'll do is I will find her link. She has some great podcasts and some resources on her
thank you
website.
so much.
Of course, yeah. And she's really the sleep expert for what are all the different things that we have to do. And I interviewed her for my podcast at one point, and she said something very interesting to me, right? Like hormones are just one part of sleep, but a lot of sleep comes down to like what our sleep hygiene has been and how we've convinced ourselves we need less sleep than we actually do. And sometimes just the way that we prepare for sleep, we have to think about it how we're preparing a meal, right? Like when we're sitting down to make like a bunch of dishes for our dinner, we're taking care and we're preparing each of those things. We have to have kind of a preparation cycle before we go to sleep as well. So she has some great resources around that. She herself, she's located, I think, in Portland, Oregon. But I think she will have on her website probably connections to other people. But I'll put that information in the chat for you. She's really incredible.
Thank you so much. I appreciate
Oh,
that.
my pleasure. I wish I had
so much I can connect with the lady right now who talk about her life and the support when you're working. Probably I will be the next in line in that kind of category. You know, it is hard for women now. It is recognized, and people like you guys, all of you who are doing this, I'm very thankful.
Oh, thank you so much. Yeah, I think I've watched everything my mom went through as I was growing up with all of her health things, and a lot of it was timed around this. But back then, in the late 90s, early 2000s. We
Yes,
just didn't have
yes,
data, right? So
yes.
there's few generations of women that we missed out on to give them the full spectrum of care. We can still do things, but thank you for saying that. This is very
Appreciated.
important work to me.
Very appreciated.
Thank you. And I put Dr. Matsumura's information in the chat as well.
Okay, thank you.
Okay, if there are no more questions, then time to wrap up. Thanks, Dr. Komal, again
My
for
pleasure.
your amazing
Yeah.
session. Really,
Thank
really
you.
appreciate your time and efforts. Thanks, Gaurav, for managing the whole thing
No worries.
seamlessly.
Thank you so much for
Thank you,
having
Dr.
me.
Komal. Yeah.
Yeah.
Right. And then we will make this recording available on our website, so that way those who miss this session can refer it later.
Yeah, and I just shared a link to our YouTube channel. You can also basically subscribe, so you can watch other recordings as well along with this session.
Perfect.
All right.
All right.
Thank you all.
Wishing all of you happy International Women's Day and enjoy with your family. Stay
All
safe.
right. Thank
Women's
you.
Day.
Happy
Thank you.
International Women's Day. Bye.
Bye-bye.